So this layout shows you the standard Jaeco WREX components. I'll go through each component, tell you roughly what it does. This is the main body of the WREX unit, and this end of the unit attaches to the wheelchair. This end attaches to the subject's arm. There's a set of wrenches, 3 wrenches that we use, Allen keys for the adjustments. This component here, these components are the clamps that attach to the wheelchair. This is the adult version of the WREX. The different components are the arm trough, the elbow pad. There's some buttons to slide the arm trough back and forth. You might want to do that to place the elbow joint close to the anatomical elbow joint, close to the mechanical elbow joint as you can, without this interfering with the joint as the person flexes. You see this is too far back, it interferes, so I slide it along with this button here so there's no interference. And then the person places their forearm into this, and we place the Velcro straps over the forearm to keep them tight in there. And then you also have an adjustment for the height for the trough, and again we use that primarily to avoid interference with this mechanical joint here. That can be done with this button. It locks in place. It has 4 slots, and that can lock in place. So this is the forearm component of the joint, and underneath you see the elbow joint here. Then we move to the humeral section, which is up here, which is this parallel bar configuration. So this is Daniel. I'm going to be measuring him up for a WREX. The first 2 measurements I'm going to take are the size of his upper arm, or humeral length, and his forearm. So with my trusty scale, this comes out to roughly about 12 inches. It doesn't have to be an exact measurement, but close. So 12 for the upper arm. For the forearm, you measure from the elbow joint to the wrist, which is about 9 inches. So one of the first decisions you have to make regarding the WREX is depending on the size of the subject. So the first thing is the size of the arm the WREX is going on, and we have a variety of sizes here for the WREX, starting with the pediatric version. So for a young kid with small arms, this is the size we use, a pediatric version. Then from there we go up to the small size for a young adult or a larger child. Then we go to the medium size for the arm, and the medium large, and up to the largest size. So I'm going to show you how to attach and adjust the trough to the main body of the WREX. I'm selecting the small trough for this, and that gets inserted from the top. This button here releases the key, and this can slide in. And depending on the size of the child and the particular configuration, this can be moved back and forth by pressing this button, and it slots into that place. We can also further adjust the trough back and forth along the forearm with this button here. You can move that, and if this is a better fit, you can leave it there and you can slide that back and forth. This is the elbow stop for the trough, and that can be bent and adjusted to fit an individual subject. So I can bend that back and angle it so it's more comfortable to use. So the first measurement that I'm going to use is I'm going to be adjusting these based on the 12 inches that I measured off Daniel's upper arm. So these two joints correspond roughly to the position of the shoulder on top and the position of the elbow. And the way the WREX comes, the size out of the box is good for about 85% of the people. But if you have a different sized child, this can be adjusted. I'm picking the middle wrench. I'll undo these 4 Allen keys, take the screws out. So this can telescope, depending on the size of the subject needed. So you have to keep in mind that these two links here have to be parallel. If this is angled like that, the WREX won't work. So these two have to slide along together. Then I can go to the next hole, insert that in there. And then I'm going to move to the next link, making sure these two are parallel. And then the other screws can go in 2 other holes. It's not critical which holes they go in. So this should be done prior to mounting it on the wheelchair and prior to placing the rubber bands. So I've lengthened this humeral section by about 1 inch to fit that individual subject. So now the length is appropriate for Daniel. For the forearm, based on the 9-inch forearm length we measured from the wrist to elbow, the large trough is appropriate for Daniel, which we already fitted to the WREX. So the next thing I'm going to do is attach the clamp, and this is for most of the wheelchairs. You have this tubular frame here, and we clamp onto this. And this slots into this piece here like that, and that can be tightened down with these screws depending on how far you want this to come out, depending on the shoulder positioning of the child. And then once you've established that, you can tighten this down, and that holds it in place. And then this vertical piece can move up and down in this slot. This is the wheelchair clamp, and this clamps onto the wheelchair. This slides into that. And again, this can be tightened down in a different position depending on the height required. And I can loosen that, do my adjustments. I can change the orientation of this, how close or further away from the patient it should be. Can tighten that down, and this slots into the clamp that's attached to the wheelchair. We also have further adjustments of these depending on what's around the wheelchair. We can rotate these for better positioning. So this knob tightens the WREX. This has been placed earlier and tightly secured. For the WREX, we generally can adjust the position of these by unscrewing these 2 screws. Then I can rotate this member. I can do the same thing here, rotate this. So these 2 links can take any shape depending on what's around the wheelchair. Then I can place this inside and sneak it in between his handle and his seat. So this is the optimal position. And then place this. I can rotate this or move it up and down so these joints line up with his shoulder. This doesn't have to be exactly over the shoulder, but this joint needs to be close to this joint. So this is the humeral part, and I place a band here between these 2 spools to give the WREX the lift. And you can adjust the number of bands to get more lift or less lift, and depending on the size of the child. Then I'm going to mount 1 band for the forearm piece, and then I'm going to double it. So that's that. And I'm going to mount a bunch of bands in the back. And these are mainly blue bands. We use blue bands for the larger sized WREX. So for Daniel, I'm going to put on about 8 bands. Then our WREX is powered. Notice I can also place a red or a blue band on the underside of the elbow joint, and that allows him to flex his elbow, to bend his elbow towards his mouth. Can you reach your mouth, Daniel?
Yeah.
Okay. Can you straighten your arm? Okay. Feels good? This is the pediatric version of the WREX. It's essentially the same functionality as the adult version, except smaller, and it comes in green and yellow. This is the main body of the WREX. A smaller trough, and this can be slid in. Depressing this button moves it forward and back. You can adjust the elbow stop and angle it for the appropriate child. This is the clamp component that attaches to the wheelchair. This would slide in there, and depending on the height required, that can be adjusted. This humeral length can be adjusted, can be made larger depending on the size of the upper arm with these 4 screws that can be lengthened. It also comes with a set of rubber bands and 3 wrenches.